It's kind of difficult to say because there's such a broad range of medical issues that you could be presenting with, but one of the common things that we oftentimes hear is heartburn. You know, it's often dismissed as just being heartburn, and when in fact it could be related to heart disease. Another common issue that men are sometimes afraid to bring up is erectile dysfunction. Sometimes that could be a red flag for cardiovascular disease. And so, you know, that's an important thing to bring up to the doctor to let them know about. And then there's a lot of medical conditions that unfortunately don't cause any symptoms. So high blood pressure, cholesterol, some of these medical conditions don't cause any kind of symptoms to alert you that you need to go to the doctor. So on top of looking out for these red flags, it's also important to just be proactive about health maintenance. It is important to visit the doctor for at least a periodic checkup. So you do want to have your blood pressure measured and make sure certain vaccinations are up to date, like your tetanus pertussis shot, and also have had your lipids screened, which is your cholesterol panel. That includes your good cholesterol and your bad cholesterol and your breakdown of your lipid panel. So those are things that you want to do proactively, whether you feel ill or feel perfectly healthy. There are some individuals that will come in feeling great, but their blood pressure may be sky high or their cholesterol numbers may be off the charts. A lot of patients don't necessarily see themselves as overweight when in fact their body mass index does suggest that they're overweight. So that's another important thing to keep in mind. So if your body mass index is above 30, you're considered in the obese range, and above 25, it's considered in the overweight range. But you know, in terms of that, of course, it all does come down to getting plenty of exercise, a healthy diet, good sleep, just generally good healthy lifestyle habits. Kind of a lot of what we covered here, talking about diabetes and blood pressure and smoking and cholesterol, all that really ties in ultimately to cardiovascular disease, preventing cardiovascular disease. That's what, you know, the purpose of treating high blood pressure is not just so that you can lower your blood pressure numbers, and the same thing with cholesterol or diabetes. It's really to lower your risk of cardiovascular disease, whether that's heart disease or stroke or vascular disease of a different sort. That's what it's really aimed at. So that's what we really think is important to focus in on.